Its way into the United States, infecting one patient in northwestern Indiana. News 18's Elizabeth Rentschler has more on what the Middle East respiratory syndrome is and one reason why experts say we should be worried. Elizabeth?
Dan, the Centers for Disease Control announced today that the first case of MERS in the U.S. has been confirmed in Munster, Indiana. While several Purdue experts say it is alarming, they also say we shouldn't panic just yet.
The fact that it's come over from the Middle East here is not surprising.
It's a virus that's killed 30% of the patients it's infected since its discovery in 2012. And now that virus is here in the Hoosier State. Friday, the CDC confirmed a patient in this Munster, Indiana hospital tested positive for Middle East respiratory syndrome. It was news that wasn't too surprising to Purdue biology professor David Sanders.
Viruses spread through something called the breaching of ecological barriers. And one of the barriers is the Atlantic Ocean.
And that's the track health officials believe the virus took. The infected patient traveled from Saudi Arabia to London and then to Chicago's O'Hare International Airport, an airport that sees an average of 41,000 passengers a day.
It is a virus that's transmitted through what we say is a respiratory route, a route through breathing. And those tend to be the viruses that we are most concerned about.
But that doesn't mean travelers should worry. Structural biology professor Andrew Messakar is part of a team of Purdue researchers studying the virus. He says in order for someone to become infected, you'd have to be in pretty close contact.
As of today, it's close to close transmission. So it's not something that's out in the wind and that we don't, we have to be really crazy about.
But Messakar does warn the MERS virus comes from the same virus family as SARS, which infected more than 8,000 people, killing 800 of them. He says that's why his team is working to find a virus inhibitor. And while they were successful, he says they still have a long way to go before discovering a vaccine.
We still don't have a vaccine for SARS virus, and it's been over 10 years. So we have a long way to go.
Now, because the patient is in quarantine in the hospital, both Professor Messakar and Sanders say there is no need to panic. However, they do say if you've traveled overseas and do start having upper respiratory symptoms similar to the flu or cold, you should see a doctor. Elizabeth Rentschler, News 18.